Hello, dear listeners. Thank you for listening to Follow Your Path. Follow Your Path is a podcast that wants to guide medical students and junior residents about different facets of the wonderful world of pathology. Since this is the first episode, allow me to introduce myself. My name is Abdul Abid, and I'm a surgical pathology fellow at the University of Pittsburgh Medical Center. I will be completing a cytopathology fellowship at the University of Virginia next year. Today, we are going to discuss misconceptions about pathology and how those negative stereotypes harm our specialty, from recruiting to regular interactions with other physicians. I have with me today Meredith Herman, a fourth year medical student at Michigan State University and vice president of Virtual Pathology's medical student group. Meredith was recently doing an away rotation at the University of Pittsburgh Medical Center, and we talked about how I had been planning to write an article about a positive case for pathology. By positive case, I mean that I just don't want to defend pathology against the accusations. I want to go on the front foot and tell people what pathology is and why it is so important in our healthcare system. Meredith offered to help me with all of that, and that was the inspiration and help that I needed. The resulting article was recently published in Medscape, and I owe that success to Meredith's push and her help along the way. There was a lot of stuff that did not make it into the final article because of space constraints. And to discuss that, she graciously agreed to take part in this conversation. This is the first episode of Follow Your Path, and today Meredith and I will discuss the misconceptions that surround pathology as a specialty. So, Meredith, tell us about yourself, where you grew up, where you went to school, how did you end up in pathology?
Well, thank you for that nice introduction, Abdul. As mentioned, I'm a fourth year medical student from Michigan State University College of Osteopathic Medicine, and I'm applying to the hashtag PathMatch 2023 cycle, and I'm so excited about that. I'm originally from Fenton, Michigan, which is near Flint, Michigan. And growing up, I had no physician or laboratory professionals in my family. So, like many people, my story of ending up in pathology is not very straightforward, and I attribute it to fate. I am the first in my family to go to medical school or have any interest in laboratory medicine for that matter. So, not having role models going into college made it very difficult. When I enrolled into the medical laboratory science program at Michigan State University as an undergrad, I contemplated a lot of different careers, but more specifically was interested in laboratory science. I toggled around the ideas of going into optometry, getting a PhD, getting my MLS certification. But then I fell in love with being at the microscope, and I loved studying the cells and understanding their physiology and role in human health. And that's when I knew I wanted to be involved in medicine in that way and help contribute to patient care. It wasn't until I received a scholarship out of the blue and was invited to meet a scholarship donor who is named Dr. Billman. And this donor so happened to be a pathologist. And soon after meeting Dr. Billman, he became my role model, mentor, and coach, and helped me along the road to medical school and ending up in pathology. So, in medical school, it was very challenging to find experience, as we will touch on. Getting exposure to pathology is very challenging in general. So, in my second year of medical school, I took a gap year and did a post-sophomore fellowship at the University of Toledo Medical Center to attain hands-on experience and work in the field directly. And I loved how pathology was involved with patient care from the beginning of a blood draw to the final diagnosis. And after the fellowship, I had so much fun, and I left the experience knowing that pathology is where I wanted to be. And being involved with different pathology interest groups like PathSig and being on Path Twitter and starting a Path group at my own school, I got to meet so many medical students and residents and pathologists. I just met so many amazing people in pathology, and it helped shape me in countless ways. So that's my story in pathology. Now, getting back to how Abdul and I met at UPMC, that was truly a coincidence. I, showed up on my first day, and as soon as I walked in the resident room, Abdul turned around and he said, "Hey, I know you from Twitter." So all of us can take away that pathology is a small world, and you're going to meet friends wherever you go. In that time, we got to talk a lot about pathology and stereotypes and barriers to accessing pathology and recruitment into the specialty. And we specifically talked about the negative perceptions towards pathology. And We found it was important to discuss these themes and resulting in that Medscape article, which you can find online and read it yourself. And we want to hopefully prove to our listeners that pathology is one of the most fun and rewarding specialties out there. So let's dive in and discuss some misconceptions that come to mind when we think about pathology. We discussed misconceptions and comments that pathologists are often confronted. And as Abdul will touch on, some that he's faced as a pathologist himself.
Right. Yeah. So one of the things that has been accused, pathologists have been accused of
Whether
is,
pathologists are real doctors.
right. Yeah. So one of the things that pathologists are accused of that they're not real doctors. I remember I was at a conference in somewhere in Texas, and I was staying at an Airbnb, and my host asked me if I was what I did for a living, and I told them that I was a pathology resident or a pathologist, and they were like, "Oh, so are you a pathologist or are you a doctor?" And I was like, I am actually both. They were not sure what how these things could reconcile. So I briefly talked to them about pathology, and then even within my own family, and I come from a long line of doctors, there are misconceptions on what pathologists actually really do. And I've had long conversations with my family members on this topic. So this is something that is widespread, and unfortunately, some of that misconceptions are because of the stereotypes that are in the media. That the only exposure a common man has to pathology is through crime TV and forensic pathology, maybe, and even then not in a positive light mayhaps, because let's say in Dexter, there is a forensic technician who lives a double life of like going on murderous sprees and stuff. And in the movie Pathology, there are pathology residents who go around killing people, which is probably the last thing that pathology residents have time to do, honestly. And in other shows, like for example in House MD or in The Sopranos, so people are doing pathology stuff, but they're not pathologists. They're like regular doctors, which is not how it really happens in real life. So these are some common stereotypes that we have to face, and I think this is a problem that leads to a lack of exposure. And then eventually, if there is lack of exposure, then there is problems with recruitment, and pathology ends up suffering as a result. The whole specialty suffers because of this problem.
Absolutely. And I remember even in my own school, it was a very there was little knowledge of what pathologists are because so few people applied. Is basically between 0 to 1 person applied to pathology a year. So I think a lot of medical students are faced with limited exposure and maybe poor guidance. I remember at one time as a medical student, I asked about pathology and was told, well, that's a different thing. You have to go to PhD, get a PhD. It's not a doctor. It's a different pathway, and that was very discouraging as someone who knew pathologists were doctors. And so it's a nationwide and multi-level problem, don't you think?
Yeah, I think it is a global issue. Like even in Pakistan, when I was in medical school, I didn't know that pathology was a career option, even though I loved pathology as a subject. I loved trying to understand the pathogenesis of diseases and the pathophysiology, but I was never encouraged to opt the field as a profession. Like I saw people who were pathology people, but most of them that I knew were teachers. So the only thing that I saw was that pathology and teaching were two things, but never as pathology as a full-time job, that as something that you do other than outside of a classroom. So this was something that I took away from medical school.
Absolutely. And a lot of people associate pathology with Pathoma and Dr. Sattar and the phenomenal book that Pathoma is. And I think students begin to associate pathology as a specific topic you learn in medical school
Hmm.
and not as a distinct medical specialty.
Yeah.
But in reality, pathologists do practice pathology. I mean, the two are combined in many ways.
Hmm.
So I think having pathology role models as those teachers can help direct students towards the specialty, especially if they are very strong in histology and pathophysiology. Um, And another question, another thing that has come up, especially as a DO, can DOs be pathologists? And I just wanted to bring that up too, because there's a lot of misconception whether DOs can actually be a pathologist, because there's, quote unquote stereotypes that there's no patient care and pathologists don't care for patients, which we will get to here shortly. But in reality, there's a lot of DOs out there that are pathologists and a lot of MDs and international graduates. And so pathology is a very diverse community full of people with various backgrounds.
Yeah, I completely agree with that. Some of my favorite people in pathology at least my residency institution, they were DOs, and there was never an issue with them having like practicing pathology and learning about pathology. Like there was no difference. I could not tell if this person was an MD or a DO, honestly. Like I learned equally from both of them. So that was my experience.
Absolutely.
Yeah.
All right, so shifting gears a little bit from now that we've clarified that pathologists are actual doctors, how about the misconception that pathologists do not participate in patient care? What are your thoughts on that?
I have some very strong thoughts on that because I struggle with this concept, like what is patient care? Is patient care the fact that you actually get to see a patient face to face? Because in that case, I think physicians assistants or medical assistants or nurses actually see more patients than people who call themselves real doctors. So like I don't understand what that obsession with face time necessarily is. And if patient care means taking care of a patient, like making medical decisions about a patient, then pathologists spend most of their time in their work time, they are actually taking care of patients. Like we may not see their faces, yes, but we see the tissues that are collected from them, body fluids that are collected from them, biopsies that are collected from them. So we are also doing patient care. And pathologists are so important to patient care, like starting from the first blood draw that an infant gets when they're born until their last breath, when they may get a lab test or they may even get an autopsy. A pathologist is going to perform that. So from like the cradle to the grave, pathologists are involved in patient care. So I find this accusation odd, and I have always tried to put forward the impression that pathologists are intimately involved in patient care. According to the CDC, almost 70% of clinical decisions are based on pathology results. So I think that this misconception should be laid to rest like soon.
Absolutely. And I think a lot of students, medical students, who are thinking about primary care and they want to care for patients, should strongly consider pathology, because there are numerous specialties within pathology that have a lot of direct patient care, such as cytopathology, where you're going to the patient bedside and performing fine needle aspirates, or even during transfusion medicine and blood banking. There's a lot of clinical aspects to pathology that we're not really taught, or see very often in our rotations and training. So, Abdul, can you kind of share more about your experience with cytopath and more patient care?
Yeah. I mean, cytopath is just one of the examples of which you can actually do, like actually like fall into the conventional face to face basically patient care. And I remember this one case that I tell a lot of people is that I remember doing going to a breast FNA on an elderly African American patient, and she has had a history of cancer before, and it was a palpable node, and she had gotten treatment, so she was in remission, but she had a palpable node, and the radiologist wanted us to basically look at that node in cytology and see if it was, maybe there was a recurrence of cancer. So once we did the FNA and we told them after multiple passes that it was benign, and the radiologist told the patient just started crying. Like she was so overwhelmed with joy that, oh my god, that like she does not have cancer. Like I feel like that, like in cytopathology and in pathology in general, but particularly in cytopathology, we get to see patients at a fork in the road. Like based on what we tell them, it could change their lives. They can have cancer or they cannot have cancer, and either way, it's a different. If their life is going to take a different path, so pathologists are crucial part of patient care, and I think that is one, just one way. The cytopathology is just one way. I mean, even in hematopathology, you can get a blood smear and of an unsuspecting patient, and you can find things like, I remember we diagnosed someone with, I believe the patient had lymphoma, and like there was very minimal signs and symptoms of that, but someone was suspicious enough, thankfully, to send us the smear, and it was lymphoma, and it was like, did, were we not involved in patient care at that time? I don't know. And then I saw multiple cases of patients having immune thrombocytopenic purpura that was originally diagnosed on a smear, essentially. So that is another example. And in transfusion medicine, we did therapeutic plasma exchange for patients with TTP. We saw many of them getting better. I was also involved in management of patients during early COVID when there was a coagulopathy issue that physicians were not sure how to take care of the coagulopathy that was being developed in severe cases of COVID, and they consulted us in pathology, and we were intimately involved in forming an algorithm essentially to excuse me, to tell them what to do in what case. So I mean, I like I said, like pathologists are involved in patient care. This is just ridiculous to think otherwise.
Absolutely. And I think for the students who are listening, or doctors who have gone, obviously through medical school, we could think back to rotations where we're rounding on patients, and in the morning we're submitting the lab order, get blood draws every 8 hours, and we're frequently checking for those results to upload into the EMR, to monitor the patient's electrolytes and whatnot.
Hmm.
So it kind of came to seeing that pathology in the laboratory was just a black box. You submitted the order on the computer, and then it just bounced back.
Yeah.
But even rounding, I would see the phlebotomist going to draw the blood, and then I knew from my experience that would go down to the lab, you put in a automated machine, and then there'd be a pathologist and making sure the results are accurate. And there's very very many people who are involved in that specimen who touch that test tube and lead it to the final result.
Hmm.
So pathology is very much not a black box, and there are a lot of people involved in the laboratory to ensure that there are accurate results and that they guide the patient's treatment plan.
Hmm.
So that was very valuable to me, seeing that in every rotation I had been on.
Yeah.
Yes, absolutely. And I want to share a story too. And I remember it very prominently because I saw how involved pathology was in patient care. And this kind of demonstrates that, whereby a patient came in with severe eye pain, and everyone thought, oh, glaucoma. And, that was it. And then we drew some blood work, and, we looked at the results, and he had a blast count that was through the roof. And then they did a differential, and there was a lot of granulocytes, and there was a lot of blast count. And they did flow cytometry on it and cytogenetics, and he had leukemia. And so that was very amazing because I got to watch this play
Mm.
out,
Yeah.
and that patient was able to get treatment. So, it really demonstrates the role of the laboratory in guiding patient care.
Mm. Yeah. Yeah. Definitely. Yeah.
So, another thing that comes up with pathologists is that they don't really like caring for living patients. And we've kind of already touched on this, especially with stereotypes that pathologists, only work in morgues and they're in the CSI cases and forensics, which is true. There is a portion of pathologists who do forensics. But, there's a lot of popular culture that obviously displays them in the morgue. But there are a lot of examples of how pathologists are involved in care for living patients. Can you share your thoughts on this and any experiences you've had in such a way?
Yeah, I mean, pathologists take care of patients, be they alive or they have deceased. And pathologists, like when you do an autopsy, a lot of people do not think of that, but it is the final medical examination that someone is going to get before they are like buried or interred, or like this is the last thing that they are ever, the last doctor that they're ever going to see. So being, I don't think that pathologists should shy away from the fact that we are also involved in doing autopsies. I mean, I think it's a critical part of medical knowledge and pathology training to learn how to do an autopsy. So that I don't want to deny that fact. But we obviously, autopsy is probably outside of forensic, even in forensics, autopsy is not the only thing that they do. for a general pathologist who's not a forensic pathologist, autopsy is maybe like less than 5% of what they actually do. So everything else, it's for living patients, people who are still alive, people who are in the hospital, people who are doing outpatient. Like there's very little autopsy in other, like outside of forensic autopsies. There is not much focus on basically deceased patients. Everything else that we do is for patients who are living and whose lives can still change based on our decisions.
Absolutely. And there's a lot more to say about that as well. And you can read the Medscape article that Abdul wrote about how involved pathology is in patient care. Another important item to bring up is how you were at some gathering and your non-pathology colleagues came up and started, joking with you a little bit about how you don't work long hours and how you come in late and leave early. That's very interesting that perception exists. Can you touch on that and in your thoughts?
Yeah, unfortunately, this is a perception that people who are not in pathology but are in medicine, they have about our about our specialty, that pathologists are coming in at like whatever at their leisure times and then they leave, and they are basically not in a time crunch, which is completely opposite to reality. uh, I have been at the hospital during my residency and then later in fellowships, like starting at somewhere between 7 and 7:30 and not leaving until maybe 6:37, like almost the same hours that an internal medicine intern does, maybe longer sometimes. So it's not. It is definitely not true. Maybe in like some remote part of the country where there is not a lot of pathology going on, there are a few pathologists who have this luxury after like years and years of experience. But even, and I have, and I say this as someone who has worked in some remote parts of the country, and this is not the case at all. Like people there work until like 6 7, like, so it's not reality. And I was actually at an art auction in Galveston, and there were I met some residents, and I believe, I'm not sure if they were internal medicine, but like they were not non-pathology residents. And when I introduced myself as, say, I told them that my specialty, they were like, "Oh, so what, you roll in at what, like 9 10, and then you were gone by 3?" And I was not happy hearing that, because particularly not just because it is from like some people who I've just met, but also because these are doctors. They should know better. And there's also recently there was this thread on Twitter, someone saying that, oh, pathologists are not available on the weekends, which is contrary to my experience. Like I have been on call so many times and I've had to go to the hospital at all hours. It does not matter how far I lived, what time of the day it was, if it was like if there were like biblical rains going on, I had to go to the hospital. I had to be there physically present. So I don't know where people get this misconception from.
I'm wondering the same thing, but somehow it circulates. And I've done some reading on this about the student forums where medical students go in and they start posting things like, oh, pathologists only do autopsies, and pathology job market is awful. You can't. There's no jobs in pathology, and I think there's a lot of things like that that circulate on the internet, and people think it's true. And there is data backing up that that's not true. That there actually is a great job market, and pathology does have a great lifestyle. Perhaps people equate a good lifestyle with coming in, late and leaving early, which I mean that is great. But pathology I think has one of the most balanced lifestyles out of all medical professions. What do you think, Abdul?
Yeah, I actually, that is true. Although it's not always like, I have seen pathologists being overwhelmed with work as well. So it's not always the same, but I would say that yes, with time and like with, if you have colleagues who are supportive, or if you're at a place that is, if you're at a practice that is supportive, then definitely you can be more involved in, like, there is a better work life balance. Personally, I don't think there's a thing as work life balance. Like it is a little fuzzy, and but I think that I like personally, when, this is one thing that I like to tell people who are not in pathology. Some of my favorite people that I've met in my life are in pathology. Like people who are like very interesting. They do a lot of other things as well. Like I knew people who were like bird watchers or people who had like some very interesting hobbies. And I didn't meet a lot of people outside of pathology in other aspects of medicine who did do those things or could do those things. So that way, I think pathology is unique.
I totally agree. And not to say that we don't work hard.
Yeah.
Pathologists are very hardworking people. And on the flip side of this too, the one part of the hospital that is running 24/7 is the laboratory.
Hmm.
Those machines run all day long because patients are always going to need care and labs drawn, even if it's a holiday. If they're in the hospital for weeks on end. I mean, the hospital laboratory, is very busy, and they never close. And so pathologists are, medical directors and lab directors. They oversee the laboratory, and there's always going to be a pathologist on call. We're up early in the morning. When frozen sections are needed by surgeons, a patient needs an urgent, apheresis or blood from the blood bank. Pathologists are there at all times, and they're always on call, ready to take action.
Yeah, I completely agree. And transfusion medicine is like it's like almost like being in critical care medicine. It's like you're always on call, as in like you when you're on call, like it doesn't matter what time of the day it is. If someone needs like products and they needs to be triaged or there is a transfusion reaction, like there are so many things that go wrong, and the transfusion medicine specialists are amazing. Like I envy them. Like they are great. Like uh they are available for patient care 24/7 in a way when they're on call. Like it's a whole other aspect of pathology that a lot of people do not even know about that this exists. So,
We hope to showcase what great things pathologists do throughout this podcast. And one more thing I wanted to bring up is also the aspect of visibility in the specialty, which in your article, you say visibility is really important. So, what do you think, are barriers to the visibility of pathology, and how do you think, these can be addressed?
I think the image problem that pathologists have, some of that has to do with visibility, because if medical students and people who are not even in medicine, they don't know what we do, then it is very easy to just forget about us. And that has larger implications for our specialty, especially when it comes to like lawmakers and stuff, because a lot of the money that is earned by pathologists, it comes from the federal government. And if the federal government doesn't know that pathologists are important or this vital to our specialty, then it is easy to cut their funding. So, and that has a knock-on effect on private insurance companies. So that's why visibility is very important. We have to be out there. We have to advocate for our specialty. We have to be visible. That involves being active on social media, being involved in your hospital committees, being involved in advocacy efforts that different organizations do, to go to Capitol Hill, like to go to your state capital. Like different organizations have been doing that. And I think it is vital for the survival of our specialty to be more visible. And from a recruitment perspective, going to medical schools and not just being there as a teacher, but also being open as a mentor for medical students and telling them that there are electives, for example, available in pathology that they can do, and they can be exposed at an earlier stage in their medical career when they're still formulating their opinions on which specialty they can or would choose. So I think it is very important and pivotal for pathologists to be visible.
Absolutely. And it does begin early on. And even as far as undergraduate and high school, and I know there's a lot of great initiatives that have been put forth by the pathology community, like Path Outreach Program, Path Elective, Path SIG. There's a lot of grants for medical student interest groups out there to start getting pathology exposure in the medical schools. And there's a lot of students who are ambassadors for the specialty. It really starts, with all of us, and we're all putting a lot of effort. And I hope to see, increase in applicants this residency application cycle, and hope that all these efforts will pay off. And I'm sure they will. It's a very exciting time.
Yeah.
So with that, we had a really great discussion with all these different topics. And to our listeners, we hope that you've learned a lot and you've enjoyed this podcast, and we welcome you to follow us and continue to support us and listen to our podcast. So, Abdul, what are the plans going forward for the Follow Your Path podcast?
Right. So the Follow Your Path podcast, in the future, we want to talk to specialists in different subspecialties. For example, dermatopathology or GI pathology. We want to talk to them and ask them what makes their particular subspecialty unique. Like, why should a junior resident or a medical student thinking about a fellowship, why should they choose their specialty over others? So because I feel like there's a gap between when you start a residency, everyone just starts asking you, oh, so what kind of fellowship do you want to do? A lot of people have no idea what they want to do. So to bridge that particular gap, this is one effort. I mean, obviously, this is not going to be perfect, but we're going to try our best to highlight different areas of pathology, and hopefully that will help medical students and junior residents choose their path in the profession.
That all sounds very exciting, and I'm excited to see how this progresses and having other speakers on this podcast. So with that, we hope to have another one in the future.
Yeah, yeah, definitely. Yeah, definitely. We will be talking. And Meredith, I'm glad that you decided to be the co-host. And from us, thank you very much for listening, and we'll see you guys soon.